Hi everyone, welcome back to the series of video lecture on thoracic trauma. This is second video. Here we'll talk about the rib fracture. So it is talking about rib fracture, the most common cause of thoracic trauma, that is rib fracture. And rib fracture is very common in case of adults with thoracic trauma, but if a child is having a trauma to the thoracic region, the rib fracture is not that common because in case of children, the speciality of ribs is that the ribs are more pliable. It means that if it during a trauma to the ribs will bend instead of fracturing. Instead of getting broken or fracture, the ribs will bend inside. That is, the rib will buckle inside because the ribs are more pliable, and thus the fracture is uncommon, but there are high chances that there is damage to the internal organs. Whereas in case of adult, there are high chances like rib will fracture. And the other one thing what we have to remember is that the management of rib fracture and the management is adequate analgesia, that is we give painkillers. And this thing is very important that we have to understand that the strapping is avoided. There is no strapping should be done. That strapping is like we are putting a tight plaster over the area of fracture in order to splint the area of fracture. But here, in case of rib fracture, if at all strapping is done, it will cause a very severe pain to the patient, and due to that very severe pain, the patient will stop taking the deep breath. So strapping is avoided, and the management is basically the adequate analgesia. And we also have to understand that it is very uncommon to have fracture of the first rib as well as the fracture of the 10th and 12th ribs. And only fracture of these ribs undergo if there is a very high velocity impact during the trauma. And if at all there is a first rib fracture, we have to understand that with the analysis from the anatomy, what we know, we can find out that during first rib fracture, there are chances of damage to these structures, that there can be subclavian vessels damage to the apex of the lung and also the brachial plexus. So this is a important thing. We have to remember this. And also, as I said, it is very uncommon to have the 10th and 12th rib fracture, which is also called the floating ribs, we know from the anatomy. And if at all it is damaged, on the left side there are chances of affecting spleen, and on the right side of damage it can affect the liver. And also, one last thing we have to understand with respect to questions coming, like during the CPR, that is cardiopulmonary resuscitation, we know we do chest compressions. So the chances of rib fracture is common, and the ribs fractured most common during CPR is the third to fifth ribs. So this is overall very important things what we have to know from rib fracture, starting with it is a most common cause of thoracic trauma, and the difference between the rib fracture in case of children and adults, like in children ribs are more pliable, so the internal damage is more than the fracturing of rib itself. And the management of rib fracture is adequate analgesia, and stopping is avoided. And in first rib and the 10 to 12 ribs are very uncommon to fracture. If at all the first rib is fractured, we need a high velocity impact to fracture the first rib and 10th and 12th ribs. And in case of first rib fracture, the structures which is damaged is apex of lung, the subclavian vessels, and the brachial plexus. And in floating rib damage to the left side affecting the spleen, and to the right side affecting the liver. And the last thing, during CPR, the third and fifth rib fracture is most common. Thank you.